Welcome to Follow the Medical Record, where healthcare experts give insights into the increasing importance of following a patient's medical record through the health ecosystem with compliance, privacy, security, and efficiency front and center. This podcast is brought to you by MRO and hosted by Don Hardwick, Senior Vice President of Client Relations at MRO. Don has been in the health information management industry for over 40 years and has extensive knowledge of how medical records make their way through the healthcare ecosystem. At MRO, Don is responsible for strategic client engagement programs and overall client satisfaction. To hear from all of MRO's industry experts, be sure to visit mrocorp.com for additional content and to sign up for our monthly e-newsletter. Over to you, Don.
I'm your host, Don Hardwick, and thanks for listening to Follow the Medical Record. You can learn a little bit more about me and MRO on MRO's website at mrocorp.com and can connect with me on LinkedIn. And be sure to connect with us also on Twitter at MROCORP. I'm excited today to have Lisa Disalvo join the show to talk a little bit about healthcare and some of the products that are coming out that can enhance a patient's experience. And Lisa is MRO's product officer and has joined our team in 2020. Lisa, if you would, give the audience a little bit of your background and your role at MRO.
Sure. Thanks for having me on today. It's just really exciting to be here. This is a really exciting time in healthcare, and particularly in healthcare technology. As Don mentioned, I joined the company last fall in the middle of COVID, which we're all still continuing to adjust to one way or the other. I have too long of a career to probably talk about in product development across the healthcare sector. I've been in the provider space, I've been in the pharma space, have a lot of familiarity in building products out to improve operations and access, payer side, that kind of thing. So my role at MRO is to really help us continue to live into our mission and our vision, and that's to accelerate the transformation of how health information is used across the industry for our providers and for their patients. So we've got some exciting things coming down the road, and I guess we'll talk a little bit about that today.
So those products that are coming down the road, what are you seeing, Lisa, in terms of not only MRO's involvement in those products and bringing some of those tools, some innovation to the market? What are you seeing overall that can help or enhance a patient's experience?
Yeah, it's a good question. I think one of the things that I pay attention to, and I'm sure most of our listeners do also, is what are the trends that are driving some of the innovation, the activity that we see right now? And so I think sometimes it is important to take a little bit of a look back at the same time when we take a look forward. And, you know, certainly all of our world has been, literally all of our world has been influenced by COVID. COVID just flipped so many things on its head, right? Particularly this notion of what I would call technology-enabled ordering. We as consumers just have such a different expectation now, or a more immediate expectation for ease of use to order things, to get things delivered to us, and quite frankly, to never leave the house. I have some friends who may never leave the house again because they really don't need to. And so even though that's a consumer-facing thing, it certainly is influencing some aspects of what we're seeing in healthcare. And just at a very practical perspective, on the provider side of things, offices shut down for a while, health systems shut down for a while. So the ability for an individual to walk in and say, I'd like my medical record, restrictions had to get put in place, and that also really influenced, how we wanted to think about things and caused us to have to make some changes probably more quickly than we might have otherwise. And I think the last piece of COVID was just the wide swath of population, a much broader demographic that needed access to their records in a different way. I know I have kids in my 20s, and they were getting tested regularly, and they needed to get a copy of that test and that information. And so they were never sick before and certainly experienced the need to get their health information for multiple reasons in a very rapid way and in a new way. And so, I think there's aspects of the population now that never thought about this thing before. And because of COVID, it forced us or caused us to want to think about innovation and patient access to their information in a new way. So that's one trend. The other trend, Don, is just this sort of chicken and egg thing that's been going on, or what I call chicken and egg, that's been going on in terms of regulatory changes. So, consumer awareness around, healthcare is just such a regulatory-driven industry, and for those of us who are in it, we accept that. The average consumer just doesn't even think about those things. But over time, right, as the administration and others have tried to improve interoperability and regulations change, even though it takes a long time for those to take effect, technology advancements come along the way to try and jump out in front and take advantage of that for all the right reasons, right? And so those regulatory changes and as things like the Apple Watch, and I don't know if anyone remembers the CMS blue button and CMS's concept of the consumer backpack, or the health information backpack, I think they were calling it. Those things start to get out into the public domain, and individuals who don't think about their medical records now start to think about that. And so, we see that's been playing out for a while, for a number of years now, and it seems like that's starting to accelerate as you just hear and think more about it, particularly when companies like Apple and Google and others try and, enter into this sort of space. And then I think the other thing that you just can't ignore anymore, which is the flip side of that, is just the increase in cyber attacks and breaches, particularly in healthcare. Healthcare is very vulnerable, very valuable information. And so on one hand, individuals say, gosh, I want my information for myself and I want it to be available to others. And then, oh my gosh, I don't want it to go overseas to some offshore hacker who's going to do something with it. So those three big trends are starting to have influenced how we at MRO are thinking about patient access and technology. I don't know if that's helpful, but that's one way that we've started to think about it.
Well, you're certainly right. We're all consumers in a lot of different areas, and the whole drive in that consumption of resources and in the consumption of information, I think, stimulated somewhat by COVID, and then obviously stimulated too by the availability of certain technologies that have grown accustomed to, is adding to the enhancement of the need for patients and the healthcare providers, one, to receive information about their healthcare and to be a better participant in their own healthcare planning. And then from the hospital standpoint and provider standpoint, is to infuse that with the availability of patients, those consumers, to get access to that information. I know we've had on the show here some discussion about information blocking, and that's been a push from a legislative standpoint over the past year, and still occurring today, of course. And then just the availability of telehealth and information and how to get access into the healthcare delivery system has been an important issue that we've discussed here on the show. So from your standpoint, what are some of the hospitals doing now to provide an avenue for their patient population, number one, to get access, and number two, the ones that have gotten access, what has been their perception of how easy it is and the methodology that the hospitals are using for them to acquire their information?
Yeah, good question. I think there's this notion that you can sort of create an app for anything, and that just streamlines the world. And I think for those of you listeners, you recognize and understand how complicated health information and the technology that supports it is. And so what seems like it could be fairly simple is actually relatively complicated, unfortunately. And so, that's a part of the reason why at MRO we developed an application or a tool, if you will, called eExpress to start to help our healthcare clients, technology teams and HIM teams simplify patient access. I mean, at the core for MRO, we are just zealous about patient access. We want it to be easier, of course, but we also want it to be safe, and we want it to follow a logical workflow. And I think one of the things that just naturally happens is when an individual starts to see their own medical record or starts to see information, it raises questions. It causes them, to your point, to want to be engaged in their care, but there's just a lot of things that the average consumer doesn't understand. And so we've tried to make that really simple by having a very streamlined process that meets a wide range of technical capabilities for an individual to request their medical records. I think one of the things that many health systems are facing is the notion of their patient portals. And patient portals sometimes don't have all the information that an individual may need or might not be able to integrate across multiple different types of technology as healthcare systems continue to evolve and merge and change their systems along the way. So there's a limitation to patient portals, and we wanted to partner with our health systems to help kind of make that be a simpler process, but not replace that technology, if you will. Allowing patients to direct their records to a third party. Patient portals sometimes don't accommodate that. And so we developed eExpress, and we can talk more about that as one way to help our health system clients ease that burden, if you will, or improve the access, right? Remove barriers, right, for access to records.
We're talking about access for hospitals to be able to open up the door for patients to have the information that they need for, like I said earlier, is that they can participate in their healthcare plan if they've got the information that they need. And then they can help direct that information for follow-up care and so forth. So how are the hospitals driving adoption or promoting this to their patient population? And number one, and number two is where does that introit reside? Is it on the hospital's website? Is it in some additional data that the hospital's providing patients? How are hospitals driving the adoption?
Yeah, it's across the board, right? And it's sort of a tricky thing because, at least from what I've seen, there are a number of varying factors that health systems are trying to evaluate or are evaluating to think about this type of technology. And so, first of all, just at the practical side of things, it's around the HIM workflow, right? So as we think about this application, for example, MRO's eExpress, we don't want to disintermediate that workflow, nor do we want to make that workflow more complicated. So we've gone through the investment, if you will, to make sure that is integrated together. So when an individual electronically requests their information, there are no changes to how the workflow works. So one piece is understanding just the internal workflow of the HIM department. And then to your point, it's, how does the health system think about the patients relative to just their overall market? So we've seen some health systems be really intentional around their community outreach, their community presence, if you will, and how can they use tools and communication in order to be closer to their patients and in order to be able to, quite frankly, grow their market share or be able to hold on to their market share in a community. And so There are health systems that include information about how to electronically or remotely order and receive your medical record in their discharge planning. It comes across in, we've seen a health system who has they have a strong multi-language population. They want to be able to reach them. Everyone has a smartphone, or most people have a smartphone, and so, how can they make that accessible to them? And certainly our eXpress tool works in that way. Sometimes it's as simple as just adding another link on the website, or within the patient portal, adding a link so that it can pull together. So it does run the gamut. I think, unlike the traditional medical record access, if you will, having an application that is consumer-facing allows us to sit with our healthcare providers and really understand, what are they trying to do from a marketing and a community presence? Are there market access issues that they are trying to solve for? Homeless populations, for example. And again, COVID exposed a lot of those things that were there, but really brought to the forefront where people are in their lives and how they need to access the healthcare system, and of course their information also. So we see healthcare providers who view this as not just a way for people to get their records, but as a way for the healthcare provider, the provider, to be able to just think about their community presence in a different way and use that vehicle as one more tool, right, to increase that presence and have a wider demographic of individuals access their care and their information.
Lisa, when you talk about a patient portal, is the existing market for a patient portal more limited than your product of eXpress, of what the patient can obtain?
Yeah, I think often it is, right? The portal may not accommodate all of the medical record systems that might be that an individual might need to access. The portal often doesn't allow someone to direct their record somewhere else, to a third party, for example, or to access their records legitimately on behalf of an individual, right? A third party, deceased patient, that kind of thing. And it often won't allow the recipient to receive their record electronically. So we can facilitate that right through the combination of our eXpress application. It allows the user to determine what records they want, what time frame they want them from, when they want to get them, how they want to get them, and then of course where they need to go. And that is integrated then in with the EMR systems and the HIM processes. I think the other component of that's really important, that is important for portals also, but when you get outside of the portal, we have to think about this, is just secure access, right? How do we validate that the individual who's asking for their information is really who they are? And so we had to build that in and did build in that identity verification. And so using some of those modern technologies, right, to facilitate that, depending again on how the portals are set up, might bring some advantage by using that type of technology, or our type of technology for that.
How have you seen this technology piece, Lisa, from a satisfaction standpoint or enhancing the patient's experience? Have you gotten feedback from the patient population that's using this? What's that feedback look like from an ease of use and the amount of information that they can get and the delivery of that back to them in a convenient way? Have you cued that population?
Yeah, and I was surprised, right? It's actually really remarkable. When I think about the circumstances for which individuals want to get their records and the stress that they might be under, particularly depending on what's happening in the family scenario and some of those, we weren't sure what to expect when we rolled this out. And so I have to say, I think COVID forced everyone into this very stressful situation, and we thought, overnight, everyone will want to flip a switch and start to make changes, and that didn't happen. It's rolled out more incrementally and a little more thoughtfully, which has actually been a really good thing. And we are seeing, we watch a couple of different things, right? So, and this is one of your earlier questions. We're seeing what we would call penetration rates, right? So when we look at, of all of the patient requests, how many of them are coming through this electronic tool? It ranges from about 20 to 25% to upwards of 60%. So there are still folks who want to walk in and will walk in. And I think because this is newer, the provider's desire and willingness to want to promote electronic over walk-in varies based on the health system. So to hit that 50, 60, 70% of folks getting their records electronically, those are health systems who promote the electronic options in discharge packets, in community-based newsletters, on their website. They've got posters or take-home cards sitting in waiting rooms, those kinds of things, right? So that individuals are constantly exposed to various options for how to get their record. Having a computer available for other things that they can, log on. They might be in the facility, right? But they can go to a standalone computer and fulfill the request that way. So those health systems that are getting very proactive in communicating with their patients and families are seeing the biggest adoption rates. But across the board, across all of them, the response rate, when we have a place for folks to rate, of course, and then we have a place for folks to give comments. And the comments overwhelming, like 70% of all comments are how simple it is, how easy it was, how thankful they are that they don't have to walk into the health system, how great it is to have an electronic confirmation come back. When they complete their request, they get back in email a confirmation of their request that has all the information there. The tool tips, when we think about medical or health information understanding, how people think about just health terms, right? Health literacy is the word I was looking for. When we think about health literacy and how challenging that is across wide demographics and wide age ranges, we built in tooltips along the way so that every segment of the request, if someone doesn't understand what that term means, they can click the little I button and learn something about that. And so we get feedback like, oh, I understand what I'm asking for now. And a form that you just go and check some boxes in, right, that you pick up off of a desk, or when you're doing the walk-in thing, or downloading it off of a portal, just doesn't have that kind of ease of use and education component to it. So we did really think about it holistically, and the responses have been overwhelmingly positive around that.
Lisa, in many cases, it's not only applicable to getting that information for the patient themselves, but is the avenue also available for a person that is a family member or is an executor of the patient, in terms of being able to assist in their healthcare decision making? So is it equally as available for that population as well? And if so, are there other requirements for documented proof so that we know that the person requesting that information, although not the patient, has the right to that information?
Oh, definitely. I think when we thought about the design for this product and this service, we wanted to partner not only with our clients, right, with our health system providers and how they think about their patients, but we wanted to sit in the patient's shoes also. And so I just experienced this with in my own personal situation, right? My mother passed away. My father wanted her records. He lives in a different city. The health system that they were affiliated with didn't have this kind of technology. Had they had it, it would have been so much easier for me to help him and to understand what was going on. Yes, the application allows individuals to request records on behalf of someone else. It's one of the questions that's asked: are you requesting this record for yourself or for someone else? And if it is for someone else, we do need to understand what that relationship is and make sure that it's a legitimate request. And so they can upload death certificates, they can upload legal documents if it's, for an adopted child in those kinds of scenarios. Everyone has to validate that they are who they say they are, whether they're requesting the record for themselves or for others. So ID verification is always built into that. But it does allow anyone who has a legitimate or a compliant request for a record to be able to fulfill that request. And again, we wanted to accommodate the individuals regardless of what they were asking for and the stressful situations they might be under at the time, and hopefully making that easier. That being said, because it is integrated in with our whole release of information platform and all of the compliance that is built into that, there are additional compliance checks that we make on that request to make sure that that person is who they say they are, and that all the documentation that is necessary for a third party to receive that record, right, is all there. And if it's not, we reach out to them just like we normally would. So we still, security and compliance is still our number one concern, along with expediency for the individual who's requesting, and then certainly making the workflow as appropriate and as easy as possible for the HIM team and those other folks.
If you had advice, Lisa, for both the patient population as well as the provider side in looking at the technology piece and the availability going forward, what would you suggest for the provider and the patient in looking at how to obtain that information and how to provide that information going forward?
Yeah, I think let's talk about providers first, because patients can only do what providers choose to do. And I feel for providers today, there's so much technology to evaluate and to think about, and a part of me says embrace the new options. Spend the time to really think about all the options that are there in front of you. And of course, that can be pretty daunting. I do think partnering with your or engaging with your existing partners, right? Folks like MRO who we're working with, is helpful because we understand the entire workflow and we understand our clients' technology. And I think what's new in this situation is it's not just about technology. It really is about how the health system thinks about their patient population, what their community presence is, and how they're trying to be a deeper community advocate. And so, I would say engage at a more strategic level, or in addition to the technical side of things and the compliance side of things, engage strategically and think broadly about how to use the technology more than just to check a box and get a record request, because it can do so much more than that. Again, our eExpress tool allows it to be customized to have the look and feel, of the health system and some of those typical marketing type things. But there's a strategy behind this, and our desire is to engage with our clients strategically as much as it is just on that very pragmatic compliance and workflow. So that's the provider side. Talking to patients, and ironically, I mentioned this at the beginning, right? I've been an MRO since last fall and have been on all kinds of sides of healthcare, but have not been in this specific release of information space. And now that I am, I'm much more cautious about what I do with my health information. I wish we could wave a magic wand and help everyone at the consumer level understand the goods and the bads, right, of health information and what's happening technically today, so that they were just very well educated on what their information is about and where the value for that is, and how they can get what they want for what they want, and also protect themselves and their health system partners from potential bad actors, right, and things that happen outside of our control, and maybe as a unintended consequence of signing up for an Apple Watch or an Alexa connector, right, where information is being gathered. So I do think it's an exciting time, but also a very challenging time, particularly when we're talking about health information.
You know, one of the things that I think is still foreign to most non-healthcare delivery people is just having some information on what the next step is. Where do they go to get some answers to how to obtain their records and how to get access to the patient's portal that is available? So in those terms, if you were suggesting to the patient population out there, where would you start? Where would you suggest that they go?
You know, you start with your own provider, right? I think you start with your PCP and your specialists that you're seeing on a regular basis. And I've started to do this now. I asked to talk to the office manager, right, and understand how they're protecting my information and how I can get access to my information. And I think the same thing is true if you're in an acute care setting. And unfortunately, often when you're in an acute care setting, it's not planned, right? It might be urgent or it might be more stressful. And so, you know, leaning in on the social workers that are in those settings and the discharge planners who understand those administrative processes and can be a joint advocate with the individual for what they're trying to accomplish at the time. It is about being inquisitive and asking, and maybe not asking at the time because it's not the appropriate time, but then leaning in later and really adopting a personal mission to understand where your information is and what you can perhaps do with it. And engage then in your own healthcare, right, which is where all of these quality regulatory programs are trying to go, is to get us as consumers to take greater accountability for our own healthcare. And you can't do that without information.
Lisa, this has been most informative, and I want to thank you for taking the time to be a guest on the show today. So I really appreciate your participation.
Sure, fun. Thank you.
And for more information and more insight on the patient's medical record through the healthcare system, visit our show's page at MROCORP.com and be sure to explore additional resources and thought leadership at healthcarenowradio.com. Finally, connect with us on Twitter at MRO Corp. Until we talk again, I'm Don Hardwick. Good day.